all of us really remember probably the moment we heard about what was then called gay cancer and what was happening to gay men in San Francisco and New York. And many of us thought, well, that's not impacting us. And then it started to spread, and we heard that heterosexuals were getting infected and that African Americans were infected, and people were scared. In the early years, it was a death sentence. We had clients who came in the door and 6 months later were dead. 30 clients a month we lost. And now we're 30 years into the epidemic and it's changed dramatically. In Massachusetts, we have reduced new HIV infections by 54% in the last 10 years. This is huge. We've saved 5,000 lives, and that's because we've been willing to get the right information out there. We get people tested, we get them into healthcare, we support people in the community, and we do really good, robust behavioral interventions. You can't argue with our success. 54% reductions over 10 years for the same period of time across the country. We've seen no reduction in the national infection rate. But what we're finding is there's less pressure for the federal government to actually continue to support the work we do in Massachusetts, thinking somehow that we need the money less. So we've been innovative. We've found new ways and new sources of funding. The business community is critical to that. And so we're very thankful for corporations like Eastern Bank and other corporate sponsors of AIDS Action, because they really make a difference by helping us provide the gaps in services that our folks need. Secondly, AIDS Action has become very entrepreneurial. We run 4 Boomerang stores, which accounts for over $2 million in revenue per year. We know we have to supplement loss of federal dollars with private dollars, and that you can't eradicate a disease like this without the involvement of government, business, and the nonprofit sector. The biggest challenge right now, and this is why this award is actually really so important, it's about the exposure and getting more people to hear the story. It's hard to imagine, but there are still people, particularly younger people, who don't know that much about HIV. We've cut way back in our health programs in schools, we've cut way back in our sexual health classes, and there's still a stigma identified not just with the disease and a fear about the disease, but with the behaviors that drive the disease. This disease is about sex and drugs, and despite the fact that every television show in America can talk about sex and drugs, we as a culture continue to have a stigma around certain kinds of activities. And I think we've made great progress, but that stigma, that discrimination, those attitudes are barriers to getting good quality care for the people who are infected, getting them tested, getting them to come out. Our point of view at AIDS Action, my board, myself, my senior management team, everybody who works here, we are committed to ending this epidemic on our watch. This came for us as youth, the baby boomers. We lost our husbands in some cases, we lost our boyfriends, we lost our brothers, we lost college roommates, some of whom we didn't even know were gay. And now I've seen many clients come through here, and we continue to lose people. And we are committed that in our lifetime, our generation, in honoring the people we've lost to this epidemic, need to stop it. We have the tools, we have the know-how, we simply have to have the willpower to do it.